Hello guys, so now we shall be discussing one very important clinical point regarding the pancreas as well as the biliary tree, okay? Because there are sometimes regarding this biliary tract, there can be some calcifications or stones that are formed in the biliary tract that would lead to a condition called steatorrhea. So what are the problems which will happen in the pancreas, which will happen in the liver and the biliary tract and all, we'll discuss right now. So one very important thing you should know before that is that here we have got our liver. This is our liver. Okay. And second important thing is that here you have got your duodenum. All of you know that the duodenum is C-shaped, right? So this is the duodenum which we have got over here. Now, from our previous topics, you know very well that there are two different parts here. So here we have got one duct and here we have got another duct. But before that, let me just put up the pancreas over here. So let us say this is the pancreas and this is the uncinate process of the pancreas. Right. So I might not be able to draw the complete pancreas, but I'll draw it till here. Now, here very important thing you need to understand here is that within the pancreas, the duct which you have, right, the duct which you have within the pancreas is called as the main pancreatic duct, right? And second important thing is, from my previous lectures, I have also discussed one very important thing, that there are also minute ducts that are present over here, which will finally drain into the main pancreatic duct. So these are all in the form of a herringbone pattern. I have talked about this previously. Now, leave this thing over here, and here, by the way, one last important thing, that here you have got a minor duodenal papilla and this papilla over here is called as a major duodenal papilla. I'll write down these names later on, okay? Now, here you have got gallbladder. All of you know that this is the gallbladder over here. So within the liver, you have got two important ducts, okay? What are those two important ducts? Here there is a duct that is present and this is called as a right hepatic duct. Okay, what is the name of this duct? This duct is called as right hepatic duct. In the same way, in the liver, here you have got another duct and this duct over here is called as your left hepatic duct. Left hepatic duct. Okay. Now, the right hepatic duct and the left hepatic duct, they join together. The right and the left hepatic duct, they join together and form a duct. This is called as common hepatic duct. Okay. Now, there is a duct that is coming out of the gallbladder. So, what is a duct that is coming out of the gallbladder? So, this is a duct which you see which is coming out of the gallbladder. This is called as a cystic duct. What is this duct? This is called as a cystic duct. Now, this duct over here is called as cystic. Now, cystic duct along with common hepatic duct, together they join. Cystic duct along with common hepatic duct, together they join and form common bile duct. Okay. Now, this common bile duct comes all the way like this. It passes behind the duodenum and this is a common bile duct that has come here. Okay. And on the other side, you have got your main pancreatic duct like this. You see, main pancreatic duct is joining the common bile duct, right? So, the common bile duct joins with the main pancreatic duct and finally it forms a new duct over here. This is called as hepatopancreatic duct. And this hepatopancreatic duct opens into a papilla over here. This is called as superior duodenal papilla. What is this papilla? This is called as superior duodenal papilla. Now, these things I have already spoke in the previous classes, right? Now, here one very important thing you have to understand here is that this is your common bile duct. This is your common bile duct all the way, right? This is your pancreatic duct like this. Pancreatic duct and the common bile duct, together they formed a duct here. You call it as a, what is this duct called? This duct is called as hepatopancreatic duct. Right. So, let me write it down these things over here. So, this duct over here is called as hepatopancreatic duct. Okay. Now, this hepatopancreatic duct has got an opening over here. This opening is called as hepatopancreatic ampulla. pancreatic ampulla. What is the other name for this? Other name for this is ampulla of Vater. You call this as ampulla of Vater. Ampulla of Vater. Now surrounding this, there is a what do you call this as? This is a sphincter. There is a sphincter that is surrounding the hepatopancreatic duct, and this sphincter you call it as sphincter of Oddi. This is called as sphincter of Oddi, right? Now, so exactly here you have got your sphincter of Oddi like this. Now, next important thing is that lining your duodenum over here, you have got cells. These are the duodenal cells like this on both the sides. Obviously, on both the sides you have got these duodenal cells, right? On both the sides you have got these duodenal cells. And by the way, I am also writing down this part over here. This is called as what? This is called as inferior pancreatic duodenal papilla or superior pancreatic papilla. This is called as inferior duodenal papilla. Inferior duodenal papilla. Okay. Now look what is happening. And by the way, not to forget that here you have your accessory pancreatic duct that is draining down. So this is the accessory pancreatic duct over here. Now, one important thing is that what is the function of pancreas, guys? Pancreas has got two important functions. One is it performs the exocrine activity, it also performs the endocrine activity. Endocrine activity in the sense the tail of the pancreas will release a certain hormone directly into the blood, and that is called as insulin. Okay. Then when it comes to the exocrine activity, what is the thing over here? Exocrine activity in the sense this pancreas synthesizes mainly three types of hormones. For example, if you wanted to digest the carbohydrates, amylases are synthesized. If you want to digest the fats, lipases are synthesized. If you wanted to digest the proteins, proteases are synthesized. So overall your pancreas has got two important functions. What are those two important functions? One is called as exocrine activity, another one is called as endocrine activity. Okay, endocrine activity is the release of insulin. Exocrine activity is the release of three important hormones. What are those three? One is called as lipase, sorry, not hormones, these are enzymes. Lipase, another one is called as amylase, and the next one is called as protease. Next one is called as protease. What does lipase do? Digest the lipids. Amylase digest the carbohydrates, and protease digest the proteins. Now, whenever you are eating any kind of fatty food, what is happening? Any kind of fatty food whenever you consume, so this fatty food is going to enter into your intestine. Yes or no? Let us say this is the fatty food which you have eaten. It will enter into your intestine. Now, when it will enter into your intestine, normally what is happening in you and me, I'll tell you. Normally what is happening is that this fatty food, as it enters into the intestine, what it is doing, whenever you eat food, you feel that your stomach is little bit distended, right? In the same way, whenever there is food within the duodenum, even the duodenal wall, whatever is there, this is little bit distended. I am specifically talking about the second part of the duodenum. So this is distended. Now when it is distended, it means what is happening over here? It means that this food is putting a pressure, or it is impending some pressure on these cells here. So as it is impending some pressure on these cells, what will happen to these cells? These cells will undergo compression. So when these cells will undergo compression, once the cells are squeezed, from the cell a chemical is released. Okay, from the cell into the blood a chemical is released. That is called as CCK. What is CCK? CCK stands for cholecystokinin. Okay, what is the function of this cholecystokinin, guys? What is the function of this cholecystokinin? This cholecystokinin has got two important functions. The first important function is that this will go all the way like this to your gallbladder. And what it will do? It will contract the gallbladder. Gallbladder is containing what? Gallbladder is containing your gall juice or bile juice. You know, even bile juice also is responsible for fat emulsification. Bile juice also plays a very important role in the emulsification of fats. Emulsification means digestion of fats. So it will contract the gallbladder. So once it contracts the gallbladder, what will happen? The gall juice or the bile juice, whatever is there, it starts flowing into the cystic duct. From the cystic duct, it enters into the common bile duct. From there, it enters into your hepatopancreatic duct. Okay. Now, in the meanwhile, what is happening? The pancreas are also releasing lipases, amylases and proteases. See, these pancreas are releasing lipases, amylases, proteases into the main pancreatic duct. So, from the main pancreatic duct, these three enzymes also mix with what? It is also mixing with the bile juice. So, the bile juice, right, the gallbladder juice or the bile juice along with these protease, amylase and lipases, they all come and they stay exactly at this point over here. Okay. Now, why are they not proceeding forward? Because the sphincter is closed, right? The sphincter is tightened. As a result, what is happening? The hepatopancreatic duct is also closed. Now, I have to release the hepatopancreatic duct. It means I have to relax the sphincter. Now, the second function of cholecystokinin is, this cholecystokinin will go all the way and it will cause a relaxation of the sphincter of Oddi. So, once the sphincter of Oddi gets relaxed, what is happening? The entire bile along with the enzymes, they flow into your duodenum. Where? Which part of the duodenum? The second part of the duodenum, and they start emulsification of fats. Now, this procedure which I have explained you, right? This mechanism which I have explained you, normally it is seen in you and me. Okay. But in patients, in different patients, there is different things that are happening. For example, let us say one of the patient came to me, right? And this patient is already having a stone in the common bile duct. You see, there is a stone in the common bile duct. This patient is coming to me and telling that, doctor, whenever I eat any kind of fatty food, let us say French food or whatever it is, French fries or whatever it is, whenever I eat any kind of fatty food, I will have pain in my right hypochondriac region. Why? Because right hypochondriac region you have got liver. What is happening here? What is happening is that whenever this person is eating the food, the duodenum is stretching, CCK is released, CCK will contract the gallbladder and gallbladder will start releasing the gall juice. But this gall juice, can it pass this obstruction? What is the obstruction? There is a stone. Can it pass? No. What will happen? The gall juice will go back into the gallbladder. So, when it is going back into the gallbladder, within the gallbladder, the pressure is increased, right? So, obviously, patient will have pain. So, what will I do in this condition? He will tell me that not only pain, doctor, another important thing is that nowadays, whatever stool I am excreting, right, the stools are completely yellow in color. Why yellow in color? Because the gall juice is not coming. If gall juice is not coming, then obviously the fat is not digested. When fat is not digested, this yellow color fat, right, fat is yellow, this yellow color fat is excreted out as yellow color feces, right. So, these yellow color feces, excretion of yellow color feces is called as steatorrhea. This condition you call it as what? This condition you call it as steatorrhea. Steatorrhea. So, patient is going to have what? Patient is going to have steatorrhea. Right. And not only steatorrhea, patient will also complain that, doctor, whenever I am trying to flush my stools are not flushing off. Why? Because fat sticks with the toilet plate there. Okay, fat that easily doesn't go away. And third important thing, he will also tell that obviously these stools are foul smelling. Okay, so these are the three complaints. Even if there is a stone in the cystic duct also, the patient will have a same mechanism. Right? Or let us say patient is not having any stone, patient is having a tumor, very big tumor, and this tumor is compressing the major duodenal papilla. Even in this condition also you will have steatorrhea, right? So, these are all the conditions where the steatorrhea is present. Now, if patient is having stone in the common bile duct, this condition you call it as choledocholithiasis. What is this condition you call it as? So, if there is a calculus or a stone in the common bile duct, you call this condition as choledocholithiasis. So, this condition over here is called as choledocholithiasis. So, patient is going to have choledocholithiasis. So, whenever there is choledocholithiasis, obviously there will be a lot of bile that gets deposited within the gallbladder. When there is a lot of bile that gets deposited within the gallbladder, obviously when bile is staying for a long time within the gallbladder, there will be infection that will be developed, right? So obviously anything before the stone, this entire region gets inflamed. This entire region gets inflamed. Sir, how will I see this? How will you see this? You will see this by doing an ultrasound. Whenever a patient is complaining of pain in the right upper quadrant after taking meals, you need to think there might be some stone. So immediately you do an ultrasound. In the ultrasound, you can very clearly see here. So this condition where because of stone, the proximal part is completely inflamed, this condition you call it as cholecystitis. So what is the treatment for cholecystitis? Remove the gallbladder. That is laparoscopic cholecystectomy have to be done in the patient, right? Actually, you need not to know that deep here. There are actually two important things. If patient is stable, we do laparoscopic cholecystectomy, okay, or we call it as a elective surgery. We plan and do the surgery on a specific date. For example, if patient is unstable, it means there is perforation of gallbladder, okay, then immediately we do a surgery that is called emergency laparotomy, okay, emergency laparotomy. Okay, so this is the important things which you need to know regarding the biliary tract disorders. So thank you so much for watching my video. Goodbye.